Was I born a vampire or did I become one at some point? That's a great question because technically I was born this way, but COVID finished the transition. If you've never seen me before, hi, my name is Emily, and like I said, I'm completely allergic to the sun and the doctors don't know why. For starters, the allergic reaction that I'm having to the sun is called Stevens-Johnson syndrome, and if you look that up, please use caution because it is a jump scare. Just to give you some quick background information here, Stevens-Johnson syndrome is usually triggered by medication, but for some reason in me, it's being triggered by the sun. The first Stevens-Johnson syndrome reaction I ever had, I was only a year old. It was to liquid amoxicillin because I had an ear infection. And my mother talked about how loud I screamed because I was in so much pain. The entire inside of my mouth broke out in ulcers. And the doctor told my mother that someone with a cold sore had given me a kiss and given me herpes. The next time it happened, I was 13. I had strep throat and they gave me amoxicillin, and again, I broke out in ulcers all inside my mouth. And again, the doctor told my mother that my boyfriend in the 8th grade had given me a kiss and given me herpes. The next time it happened, I was 27, and I actually took pictures of that one. I had a sinus infection and they gave me Augmentin, and I broke out in ulcers all inside my mouth, but as you can see, they were also starting to come out onto my lips. And again, at the doctor, all they did was tell me that I had herpes and send me home. Then it happened a few years later following a back surgery. The breathing tube during the surgery irritated my asthma, and that sent me to the emergency room because I was having chest congestion. They gave me a sulfa drug as a precaution, and I had a Stevens-Johnson syndrome reaction to the antibiotic. Only 2 months later, I got COVID and was sick for 6 weeks. And since having COVID in March of 2021, I've been hospitalized 4 times with Stevens-Johnson syndrome. On top of amoxicillin and sulfa drugs, we also now know that NSAIDs and ceflexin will also give me Stevens-Johnson syndrome. I'm comfortable saying that 3 of the 4 last Stevens-Johnson syndrome episodes that I had were caused by a combination of medication and sun exposure, but the last hospitalization was caused by 30 seconds of sun exposure when I walked outside to my car. There was no medication involvement at all, and the doctors don't know what is causing this.